Hello friends, we all dental surgeons very well know when to take a biopsy of any oral lesion, but many times we make some practical errors and end up getting inconclusive histopathology report from our pathologist requiring one more biopsy of the same lesion. Here I am to present some practical tips for taking good biopsy of intraoral lesion under local anesthesia. You all very well know that any lesion that is ulcer, growth or swelling which is not responding to medical management for a month requires incisional or excisional biopsy. Like any other minor oral surgery, thorough history taking, hematology as well as radiographic investigations are to be done to conclude differential and provisional clinical diagnosis. Next, prepare the armamentarium as per the clinical examination of the lesion and clinical examination of the oral cavity, type of the tissues which is to be involved for the biopsy. This include local anesthesia, number 15 blade with handle, tissue punch, atraumatic tissue holding forceps, formalin 10% as a fixative along with other routine instruments. You can have toluidine blue as a dye or a tissue stain or any fluorescent light emitting device to give you demarcated tissue part from where you are supposed to take biopsy. Now let us discuss important practical points. First, always give nerve blocks. Don't infiltrate in or around the lesion. Local infiltration of anesthetic solution will destroy tissue morphology of the lesion. Second, decide two regions of the lesion to take two different tissue beds in the same lesion. First should be the most aggressive looking area and the second should be near margin of the lesion where you can include adjacent normal tissue in the tissue bed. For this you can stain the lesion with toluidine blue dye. The area which retains dark blue color is preferred for biopsy, or you can use fluorescent light emitting devices, and biopsy should be taken from the region where there is loss of fluorescence. Third, the size of the tissue bits should be at least 3 to 4 mm width and depth wise. This will include required tissue layers for pathologists to examine. Use number 15 blade or sharp tissue punch and atraumatic tissue holding forceps to remove the tissue bits from the lesion. Make sure not to over manipulate the tissue beds to protect its morphology. If possible, pass and tie a thin suture thread to demarcate tissues uppermost to deepest side so the histopathology technician can cut the tissue or can cut the sections of the tissues parallel to this thread to involve all the tissue layers. Now the next important point is to transfer them into a leak-proof container having formalin 10% solution as a tissue fixative. Minimum volume of the formalin should be 15 to 20 times the volume of the tissue beds. Label the container with patient's complete demographic data, clinical or hospital name and contact number, date as well as time of the biopsy taken. Now the next important suggestion is to provide adequate information to the pathologist. This should include history of the lesion, any systemic history of the patient, relevant clinical examination of the oral cavity as well as detailed clinical examination of the lesion itself, radiographic findings and hematology values, anatomical area like lip, palate, floor of the mouth, retromolar triangle, etc. from where biopsy tissue has been taken. Also give adequate information about your differential diagnosis as well as provisional clinical diagnosis. The last thing to keep in mind is make sure the tissue bits stored in 10% formalin reach to the pathology lab within 24 hours maximum, as it requires to be processed within 6 to 72 hours depending upon type of the lesion. As we are the surgeons, we need to give correct diagnosis to our patients. When we can't make it by clinical examination only and require other investigations, it is most important our duty to send ideal samples with adequate information to this specialist, or else we end up with inconclusive or even false results, making our patients suffer in all the ways. I think this will help the beginners. Thank you very much, friends.